Professor Chris Griffiths. I'm Foundation Professor of Dermatology at the University of Manchester and a consultant dermatologist at Salford Royal Hospital. Dermatology consultations probably account for about 24% or more of a GP's work, so it's a significant workload. It costs the NHS about £5 billion a year. Well, Manchester Dermatology is one of the leading skin research groups in Europe, if not in the world. And what sets us apart is that our research is very much what we call translational. It has direct relevance to patient care, so it comes from questions that arise from managing patients in our clinics on a day-to-day basis, taking those back to the laboratory and trying to answer those so that we can develop better quality care. The main benefit of being part of the Manchester BRC is that this provides programmatic 5-year continual funding for our 4 research programs. One on psoriasis, which affects 2 million people in the UK, so about 80,000 people in Manchester. Photosensitivity disorders, and that's sun allergy. Hair diseases, inflammatory hair disease, alopecia areata, which is sudden hair loss, particularly in children, and then wound healing, which is a major unsolved problem at present. About 80 to 100,000 people at any one time in the UK may have open wounds. So I think one of the nice things about this BRC, one of many sort of real strong points about it, is that it's bringing together what seem to be disparate research groups, musculoskeletal, dermatology, cancer, but there are commonalities between those. For instance, in dermatology, in our psoriasis research, we know that psoriasis is linked to obesity. We know that some cancers are linked to obesity, and we can learn from what they're doing in cancer research. P4 medicine is a much broader view of what's known as precision or stratified medicine. Those 4 Ps are prevention, so can we prevent disease, which is going to be more cost effective in the long run? Can we predict disease progression, say in psoriasis, which patients are going to get psoriatic arthritis? Can we personalise it, so we get the right drug to the right patient the first time? Will patients and the general public participate? It's the participatory aspect. And we've only been able to do that now because of what's known as systems medicine, looking at all the different facets that make up an individual human being. I believe that dermatology's relationship with industry over the course of the past 20 years is a unique selling point for dermatology in Manchester, and I'm certain that the connectivity that we've made with industry and our understanding of the way that industry operates will be beneficial to other themes within the BRC. Well, having a biomedical research centre here in Manchester is without doubt going to benefit the population of Greater Manchester, because the research innovations and ideas are going to be coming into the population in Manchester first. We want them to tell us what research should be done. We want them to take part in clinical trials. We want them to promote the importance of clinical research into their local communities and what it cannot necessarily do for them, but for their children and their grandchildren.